cough.
Hey
Guys, welcome back to our channel. Thank you so much for all the love and comments on our previous videos. We loved them and it helped us grow immensely.
Yes. So आज के टॉपिक में हम डिस्कस करेंगे हेल्थ केयर इन कनाडा व्हेन यू आर एक्सपेक्टिंग अ बेबी. Since Yuvan is now 2 months old, we feel pretty confident in sharing all this experience with you.
And we hope that you benefit from this video because there is not a lot of consolidated information online about this. So stick with us till the very end because we are going to share some valuable information if you are planning to have a baby in Canada.
Yes, and do like our video, subscribe to our channel and hit that bell icon to get more updates on our future videos.
आज के वीडियो हमने 3 मेजर चंक्स में डिवाइड किया है. Our dealings with the healthcare system in Canada before the pregnancy, while we were pregnant and after Yuvan was born. पहले हम बात करेंगे about things before the pregnancy.
Pre-pregnancy is when you are planning to have a baby. I would recommend talking to your family doctor 3 to 4 months before you plan to conceive. And if you haven't enrolled to a family doctor yet, now is the time to do it.
Once you let the doctor know that you are planning to have a baby, a thorough checkup is done and you will most probably be given prenatal vitamins. Now, these prenatal vitamins are supplements that you should take before and during the pregnancy, and this helps with the growth and development of cells because it has folic acid.
Yes, and the doctor will also ask you about your smoking and drinking habits, and शायद वो आपको एक detox schedule भी दे. The mother will also be asked to get a full blood work done ताकि अगर कुछ और supplement की ज़रूरत हो तो वो भी prescribe कर सके डॉक्टर हमें.
Now, this is also a time when the doctor will ask the mother-to-be to go through a pap test. This is a cervical screening to detect any cancerous process in the cervix.
So this pretty much sums up the important things that will happen pre-pregnancy. इसके बाद हम बात करेंगे what happens during the pregnancy.
Yeah. You will keep visiting the family doctor till about 18th to 20th week of your pregnancy. हर डॉक्टर विजिट पे होगा एक यूरिन टेस्ट to detect any UTI, and the blood pressure and the weight of the mother will also be checked.
The family doctor can also refer you to a physiotherapist if there are any pains that need his attention. In case of any complications concerning the pregnancy itself, then the doctor will recommend you to meet a specialist.
Now, after the 18th or the 20th week, the family doctor will refer you to an OB or a gynae at the hospital that you select to have the baby delivered at. हमने Credit Valley Hospital in Mississauga select किया था because it is a Tier 2 hospital and it had really good recommendations and reviews.
And family doctor आपकी सारी medical history भी share करेंगे अपने OB gynae team के साथ. And when you go to the OB gynae for the first time, they will ask you to fill out some forms जिसमें आपके details होंगे regarding your insurance ताकि वो hospital में पहले से ही available हो.
Now let's talk about the frequency of your visits to the OB. From 20th to the 32nd week, you're supposed to see the OB once a month. From the 32nd to the 36th week, every other week. And from the 36th week till the time you have the baby, you will see the OB every week. This can change if there is a complication and the OB might want you to visit more frequently and want to have a close monitoring on you. COVID की वजह से partners were not allowed to accompany to the visits, so I stayed in the parking lots.
Yeah, and OB team है 10 डॉक्टर्स की, तो ज़रूरी नहीं है कि आप हर बार सेम डॉक्टर को ही मिलोगे. And also डिलीवरी भी कौन सा डॉक्टर करेगा, that's not in your control. But just be rest assured कि जो भी डॉक्टर आएगा उसको आपका मेडिकल बैकग्राउंड पहले से ही पता होगा. And doctors both male and female होते हैं, so you don't have a choice who you are meeting for your appointments and also for your delivery.
अब बात करते हैं वो सारे टेस्ट्स के बारे में which the mom gets done during the pregnancy. Family doctor की हर विजिट पे होगा BP and weight checks and a urine examination for UTI.
And first ultrasound, which is always the most special one, is done in week 6. This is to check if the fetus looks good and you get to hear the heartbeat of the baby for the first time.
Week 11 में होता है IPS, which stands for Integrated Prenatal Screening. This test is done to check genetic abnormalities like Down syndrome in the fetus. Combined with this is a full blood work for the first trimester.
So in case there is a red flag in the IPS test, or if the mother is above 30 years of age, the doctor will recommend you to get a MSS test in the week 16. This is maternal serum screening test, and it helps to identify any abnormalities in the fetus or any genetic problems.
So week 18th to 20th is the most awaited week for the parents. Because इस वीक में होता है
Anatomy test.
इस एनाटॉमी अल्ट्रासाउंड में चेक होता है बेबी के एक एक बॉडी पार्ट, ऑर्गन्स, एंड यस यू गेट टू नो द जेंडर ऑफ द बेबी.
Yes, it's allowed in Canada. Some parents choose to not know the gender of the baby and they want to keep it as a surprise. In that case, आपको अपनी अल्ट्रासाउंड वाली टीम को पहले से ही बता के रखना पड़ता है that you do not want to know the gender.
इसके बाद आता है gestational diabetes की test, which is around week 24 to 26. Some mothers can develop a type of diabetes during pregnancy, which if not monitored can be very harmful for the baby.
Yes, and it's a 2-hour test जिसमें empty stomach आपको एक sugary drink देते हैं पीने के लिए and 1 hour के interval पे आपकी blood sugar levels को monitor करते हैं. अगर इस टेस्ट के रिजल्ट पे आपकी बॉर्डरलाइन डायबिटीज आती है तो डॉक्टर्स रेकमेंड करते हैं कि आप अपनी शुगर एंड कार्ब्स इनटेक को वॉच करें एंड कुछ केसेस में अगर हाई आती है तो डॉक्टर्स आपको इंसुलिन शॉट्स भी रेकमेंड करते हैं.
बेचारे मॉम्स क्या क्या झेलना पड़ता है. एक शॉट जो हर मॉम टू बी को लेना पड़ता है बिटवीन द वीक 27 एंड 36 वो है Tdap. This vaccine is to protect the baby from whooping cough during the first 2 months after the birth.
Yes, the antibodies from the mother are passed on to the baby जब तक बेबी को BPT वैक्सीन ना लग जाए, which is in the second month of the vaccination schedule for the baby. This vaccine can make the arm of the mother really sore and मेरे केस में तो मुझे 2 दिन फीवर भी हो गया था.
Doctors also recommend the mothers to take a flu shot, but that is totally optional.
And the last test जो होता है 34th वीक में वो है एक vaginal swab जिससे डिटेक्ट होता है कोई बैक्टीरियल इन्फेक्शन एंड ये हेल्प करेगा फॉर द डॉक्टर्स टू डिसाइड कि डिलीवरी के टाइम पे एंटीबायोटिक्स देनी है या नहीं.
काफी लंबी लिस्ट है टेस्ट्स की, बट all to make sure that the mother and the baby both do fine. There are also a lot of prenatal programs that are offered by your local municipalities free of cost. These are classes that you register for and you attend with your partner, and this immensely helps and prepares you for the baby. You will find the link in the description.
अब ड्यू टू कोविड हमारे ये इन पर्सन क्लासेस तो नहीं हो पाई, बट व्हेन वी कॉल्ड एंड चेक उन्होंने हमें सजेस्ट किया कि आप ऑनलाइन क्लासेस के लिए रजिस्टर करो एंड दैट्स व्हाट वी टुक. Anything to prepare you for the big task ahead.
Yes, it sure is a big task. Our birth story and the hospital experience is a separate and big topic of discussion which we will share in a separate vlog. So updated रहने के लिए please subscribe to our channel and hit the bell icon to get notifications on our future videos.
Okay, so now comes the time when the little angel is with you, the postpartum stage. ये first time parents के लिए काफी stressful हो जाता है क्योंकि sometimes you don't even know what you need to do.
But thanks to the support from the healthcare system in Canada, ये part भी काफी seamless हो जाता है. कोई भी problem हो, talk to your family doctor. And if the family doctor is not available, even if it's in the middle of the night and the baby is crying badly, you can always take him or her to the emergency.
So starting from day 1, the baby's growth is closely monitored. Usually birth के बाद babies 5 to 10% of their birth weight lose कर जाते हैं. So until and unless the birth weight is regained, the nurses and the lactation consultants, they closely monitor the milk intake and the growth of the baby. The first milestone is to see the baby regain his birth weight, and that is usually in up to 14 days.
The nurses and the lactation consultants work with the weight chart and monitor the baby's milk and weight gain. Charges for lactation consultants are also covered in OHIP. And awesome.
Then comes the postpartum checkup for the moms, and this is usually done in the 8th week after the delivery. And अगर आपका C-section हो चाहे normal delivery हो, usually ये 8th week में ही होता है.
Last of all, we would like to talk about the vaccinations to be administered to the baby and the schedules going forward.
So युवान को day 1 पे लगा था एक vitamin K का shot, and उसके बाद family doctor से मिला हमें एक immunization का record.
ये एक immunization chart है for personal records that we got from our family doctor. You guys can take a screenshot of this for your record if required. So keeping this as reference, you can understand that the baby will be given vaccination shots at months 2, 4, 6, 12 and so on.
With this, we come to an end to our video today. Just a disclaimer, this is a standard process that is followed for a low risk, low complication pregnancy. But हर pregnancy की journey different होती है and the doctors with their experience will recommend what is best for your case.
I'm sure आप सबको बहुत questions होंगे regarding the entire process apart from what we discussed on this video. So please feel free to reach out to us at chintupintudiaries on Instagram or you can also comment on this YouTube video.
We hope इस वीडियो को देख के आपको more confident feel हो रहा होगा to go through this entire process and you would be more prepared with what to expect. In the future, we will be making more such videos जहाँ पे हम अपने experiences share करेंगे आपके साथ ताकि हम आपकी journey में थोड़ी बहुत help कर पाएं. So please don't forget to hit on that bell icon to get yourself notified for any new videos that we post.
Okay then, see you next week. Till then, bye-bye.